Dickerman. We are all registered nurses, and we all have experience in either the acute care, case management, home care, or long-term care settings. We all recognize that hospitalization may be a life-changing event, although it certainly does not have to be. And we have all been asked on multiple occasions by our patient, what exactly happens next? Oftentimes this question is filled with angst, and our role here is to kind of help you remove some of that angst and help you understand the options that are available to you after hospitalization, and then also understand the rules and regulations that are involved and help influence the selection of those options to help move you through the continuum of care. So all of the options that I'm going to discuss with you have the end goal of returning to home, to your previous lifestyle, close as we can get you to your baseline level of functioning. We know with these options, the goal is always to get you back to your house or to your apartment. Depending on your illness and your length of hospital stay, different options are available. Now, if it looks like you're bouncing back pretty quickly, you may go home with home care or outpatient services. However, if you are severely deconditioned or you just need more time to recover, you may be looking at a stay in rehab. There are two different types of rehab we have available. One is acute rehab and one is subacute rehab. If you're leaving the hospital with outpatient services, it means you're leaving the hospital pretty close to your baseline level of functioning. Perhaps you're using a walker or a cane and you did not have one of those before, but you're still able to drive yourself back and forth to your appointments. You're able to get yourself up and moving in the morning. And what will happen at discharge, your physician will provide you with a prescription to the outpatient clinic of your choice. Lots of times now they even do this electronically, so you may not even get a paper prescription. Your number for the therapy services will be right on your discharge paperwork. You call them and make your first appointment. You're ready to go. The next option we're going to talk about is going home with home care. And this is appropriate when we know somebody is going to be safe once they get in their house and they're in their own environment. They're able to take care of themselves. However, we know it will be a difficult and taxing effort for them to get out to appointments. And you must qualify for home care. A lot of people don't realize this. And those qualifications must follow Medicare guidelines. And Medicare guidelines set the gold standard for any type of care that you're going to receive, whether you're in the hospital or in a rehab. Medicare sets the rules, and all private insurance companies follow Medicare guidelines. I think that's important to realize as well. So in order to qualify for home care, Medicare says that you must be homebound, and they have certain wording and certain rules for what exactly qualifies someone as homebound. So you need the help of another person or medical equipment such as crutches, a walker, a wheelchair, cane to leave your home. Or your doctor believes that your health or illness could get worse if you leave your home. And also it's difficult for you to leave your house and you do not normally do so. You cannot be able to drive and be considered homebound, because if you're able to drive, you are able to get to an outpatient therapy service. That's the way Medicare looks at it. So you cannot drive and be considered homebound. You must have a skilled need, and your need must be intermittent. And we're going to get into that a little bit further. And you must also be established with a primary care physician in the community, because the primary care physician is the one who's going to sign the orders for home care. We do not operate independently. We need to have a doctor who's in charge of your care, who we report to. So once it's decided you're going to go home with home care, you may be curious about what type of services you're able to receive. Medicare does not allow us to provide custodial care. So custodial care is any non-medical care that can reasonably and safely be provided by a non-licensed caregiver. And custodial care can take place in a home or a nursing home setting, and it involves help with daily activities like bathing and dressing. In some cases, it can include custodial care would be help with cooking or laundry. Now, there are some certain circumstances where it can be covered by Medicaid, but that's usually in a nursing home setting. So home care will provide, remember we said it had to be a skilled need, so the skilled care you're going to receive by home care is medically necessary care that can only be provided under the supervision of a skilled or licensed medical personnel. It can be more costly than custodial care and can take place in home or skilled nursing facility. Examples would be physical therapy, wound care, intravenous injections, catheter care, and more. Again, these are skills that only a nurse or a physical therapist, occupational therapist, speech therapist would be able to provide due to their expertise. And they may be covered. Skilled needs are covered by Medicaid, and state Medicaid programs have different rules that determine, what is skilled and what is medically necessary and payable by Medicaid. But Medicare covers skilled needs only. So back in the beginning when we were talking, I did say everything I'm going to be discussing has the end goal to get you back to your prior level of functioning. And the same occurs with home care. It's our goal to get you back to being independent. Medicare recognizes that and expects our care to be intermittent, which means it's predictable and recurring, and it's provided for fewer than 7 days a week. So if you know you need someone 7 days a week, that's really not appropriate for home care. You perhaps need a different setting, fewer than 8 hours a day for 21 days or less. It has to be medically predictable and have an end date. It is anticipated that we would have an end date. We would come in several times a week to help you with your acute need with the goal of becoming independent. When you're progressing medically in the hospital and you no longer require an acute hospitalization for your medical needs, but we know you're not close to your baseline level of functioning to return home, we may start looking at a rehab stay. And there are two types of rehab, acute rehab and a subacute level of rehab. There are only 2 acute rehab facilities in the capital region. Many people don't realize that. One's at Albany Medical Center and the other's at Sunnyview Rehabilitation Hospital. An acute rehab is intense rehab for people who have experienced a major medical trauma and need serious efforts to aid in recovery. And we're talking about people who may have had a significant stroke, an amputation, severe cardio or pulmonary disease, and again, not medically appropriate to stay in the hospital anymore, but not physically able to go home. And acute rehab is intense, and you will receive 3 to 5 hours of physical therapy with a mix of occupational therapy, speech therapy, respiratory therapy, if appropriate, every single day while you're there. And they're obligated by Medicare rules to provide that level of therapy. So we have to think about that. If you're not able to perform the 3 hours of therapy a day, acute therapy would not be the right selection for yourself. And at acute rehab, you're going to be seen and evaluated by a physician every single day. They do their rounds every morning and they'll make recommendations. Is this patient progressing? Do they meet Medicare guidelines? Do we continue their rehab, or are they starting to plateau? And you're expected to make fast progress. And again, by Medicare guidelines, this rehab is more expensive, obviously, than a subacute level of rehab. And Medicare expects fast progress and the length of stay to be significantly shorter. So, if you're not able to maintain the 3 hours of therapy a day, and you're not at your prior level of functioning, but we realize with a little more therapy, you probably can get to your prior level of functioning. A subacute level of rehab may be the best option. And these are located often in skilled nursing facilities. Lots of skilled nursing facilities accept Medicare dollars and Medicare states. If you are going to accept our Medicare dollars, we expect you to have a certain number of subacute rehabilitation beds available. So they're located right in the skilled nursing facilities. And at a subacute level of rehab, you're only going to receive 1 to 2 hours of therapy a day in periodic visits from the doctor. I'm thinking probably once or twice a week. The doctor does his rounds at the facility, and you will receive your 1 hour of therapy a day. If the progress continues to be steady at rehab, and again, you have to be able to participate, but they recognize you need more time. And the length of stay is usually longer than an acute rehab. And the next step after the subacute rehab is usually home with home care, where you'll continue to return to your baseline level of functioning. So we can get you at a subacute back to where you're able to function doing household distances in the home, where perhaps at acute rehab, you leave independent. At subacute, we realize that progress is going to be slower. Subacute's goal is to get you back home again, and then home care will come in to continue working to return you to your baseline level of function.
This was kind of a slide that just was a quiet slide, just to take in all that information and kind of food for thought. Next slide. When you decide that you don't want the responsibility of a home as you age, for a variety of reasons, there are various levels of care you can choose from. The first one we're going to discuss is the senior independent living. These are independent living communities consisting of adult ages 55 plus. Some have adult ages 62 plus. You can either live senior living or in a retirement community, which consists of private homes, cottages, suites, and apartments. The average age is 74 to 75 years. There's a variety of types of homes. The first one is a retirement home or a community. They're independent. Some do offer 24 emergent help. Some of the amenities are meals, transportation, laundry, social and educational activities. The next type is a senior apartment. They consist in 1 to 2 bedroom with a full kitchen and private bathroom, with a communal dining room if warranted, and they also offer disability and accessible accommodations for equipment. The third one is the Continuing Care Retirement Center, and this offers all levels of care, but it's all in one community, and it starts with the independent care and allows transferring to a higher level of care when needed within the same community. There are a lot of commonalities of factors for independent living, and here are a few of them. The individual is not in need of assistance in ADLs and med management. You don't need medical assistance on a regular basis. You're interested in meal prep, house cleaning, laundry services while still preserving your independence. You may feel lonely, isolated, and socialization is very important to you, and a safe feeling with 24-hour staff. You are retired and just looking for the conveniences of living. If you find your needs are more, there are other types of living arrangements offered, and they will be discussed later in this educational PowerPoint. The amenities you may be interested vary in each community, and you can choose what is important to you while you're searching for the perfect place. Some include meals with culinary chefs, registered dietitians. They offer dining packages with various meal plans, including a la carte. They offer cleaning service, most one weekly. They offer maintenance for your apartment and groundskeeper for your beautiful surroundings, recreation, social, and education programs, exercise programs such as yoga, tai chi, walking, and book groups, tennis courts, swimming pools. They offer movie night, wine and cheese, educational workshops such as painting parties, technical support. Many of them have chapels, community vegetable gardens. They have hairdresser boutiques with a general store on site. They also offer transportation weekly to grocery stores and shopping trips. Of all the living arrangements, the independent living is 30 to 50% less a month than assisted living, as it does not offer personal care and health services. Although you can obtain some personal care and health services if you feel you need them from private agencies at an additional cost. I just wanted to give you like monthly costs. In New York, the average monthly cost is $2,880 a month. Annually $34,560. I put Florida in there also for people who may not want to hang around in the very cold Northeast. And their monthly is $2,220, and their annual is $26,640. So it can be quite pricey. I've given you some examples of some local independent housing. There's in Albany, there's the Eddy Senior Care with a phone number there. Clifton Park, there's Coburg Village. And in Colony, there's a Peregrine Senior Living. There are also additional ones, but I wanted to give you the main centers for our area.
Some things to consider when choosing a facility. Location can be important so the family is able to visit, but this also affects what services they can offer. So be sure they can provide the services you require. Size matters because it can impact services available, with larger facilities offering more amenities such as pools and entertainment. The staff to resident ratio. This allows you to see there are enough staff to take care of the patients adequately. Services are based on supply and demand, so make sure special services that are needed are supplied. Consider your next move. If you plan on going on to a nursing home, some facilities have multiple areas: assisted living, nursing home, etc., etc. So see if the facility you're moving into has a nursing home as well in their listings. Costs can be more at private facilities, so evaluate based on affordability as well as other important criteria. What activities and events are available, and the culture of the facility, the environment and amenities offered. Last but not least is the accreditation and training of staff. They should be knowledgeable and compassionate. motivated to care for the elderly. Some things you should look for in a assisted living. That it's a safe living environment that has little compromise of privacy, independence, or regular lifestyles. They have access to help if needed. Quality of life is enhanced without affecting their ability to feel competent and self-supported. The flexibility of care allows for interaction with friends, family, and community. Some of the assessments that are done on admission are level of care needs, medication management needs, mental status, if the patient has minor confusion or forgetfulness, ADL assessments that are completed on their own, and what help is needed. This may be reevaluated every 6 months. Sensory assessments, including vision and hearing, a physical exam completed by the doctor for the facility, dietary needs and food preferences, activity and equipment that's needed, medications that are needed, as well as their preferences such as bedtime, books, and other things. There are qualifications for assisted living admissions. The patient must need help with daily tasks such as ADLs, household chores, and meal preparation. They have minimal skilled nursing needs. They're able to walk, use a cane, a walker, or a wheelchair independently. They are able to manage any chronic conditions on their own, such as diabetes, finger sticks, and giving themselves their own insulin. Patients must be predictable and stable, with no severe memory impairments. What is an assisted living? It's a long-term care that provides limited day-to-day attention for seniors seeking some independence. The fees for services of an assisted living is $4,000 to $5,000 a month out of pocket. If you have no assets, this can change. Social Security, retirement can pay for your stay with $50 left for patients to spend on personal items. You can get Medicare or Medicaid that may help pay for the stay as well. What is long-term care? It is a comprehensive range of medical, personal, and social services to meet the needs of people that are chronically ill or disabled. They provide the most extensive care outside of the hospital. They offer care such as bathing, dressing, and eating, as well as skilled care from nursing to help monitor medical needs and treatments. Skilled needs by trained professionals for PT and OT, and respiratory therapists. Services often include 24-hour emergency care as well as social and recreational activities. The needs of the patient are requiring nursing care on a daily basis, some ongoing, others temporarily while recovering from accident or surgery. They require 24-hour assistance with feeding tubes, tracheostomies, insulin, finger stick injections, and other medical services. If the patient is bedridden and needs more attention, turning and positioning, tube feeding, etc., or needs memory care, such as in dementia, having chewing or swallowing difficulties, or behavioral issues. Things that are provided: room and board with a clean, healthy, sheltered environment, nursing care 24 hours a day with diagnostic and pharmacy services, dietary services with meal plan to fit patients' needs, and dining area, medical equipment as needed, such as a Sarah lift or a mechanical lift, bed linens, gowns, and linen service for personal clothing, assistance with ADLs, toileting, and transfer needs with mobility issues, social services as needed, as well as optician, podiatry services, PTOT, speech as needed. They even offer respite care and hospice care. What to look for in a nursing home? Does it provide the level of care needed? Does it meet state or local licensing requirements? Does the director have an up-to-date license? It meets state fire requirements with sprinkler systems, fire doors, and evacuation plan? What are visiting hours or the policy on insurance and personal property? What is the procedure for medical emergency? Is there a waiting period, and what are admission requirements? Are fees competitive, structure easy to understand, or have they increased significantly in the past few years? What are billing and credit card policies? Are there different costs for different levels of care? Is the place homey, clean, and well kept with appropriate heating and cooling? Payments can be made through Medicare and Medicaid, private insurance, and personal funds. It may be $350 to $450 a day out of pocket. Medicare only provides 100 days of nursing care, and only if required skilled care and it's referred by a doctor on discharge from the hospital. Medicaid covers nursing home services, but requires patients have no assets. Covered services vary widely from state to state, and to be eligible, you have to spend all your assets first before you qualify for Medicaid.
As we endeavor our journey through our life as aging takes charge, it is important to express your wants through the aging process and as well at the end of your journey. It's important to choose and allocate a healthcare proxy to fulfill your wishes in the event you cannot speak for yourself. This does not have to be done with a lawyer. You can do it in your physician's office, in the hospital. It just needs a witness. As you experience chronic disease and serious illness, you have choices in your treatment plan and your approach to care. One approach to end-of-life care is palliative care, and this is a palliative approach that consists of the pursuit of medical treatment that enhances a person's care with a focus on the quality of their life for the patient and the family. You can ask for a referral yourself, or your healthcare professional can request one. And the support systems are a holistic approach, which consists of physicians, nurses, social work, nutritionists, and chaplains that support your journey. You can be supported in the home and acute settings, such as the hospitals, nursing homes, and or outpatient clinics. And if you're a veteran, you can get that through the Department of Veterans Affairs. Another approach to care is hospice care. Many patients face chronic and acute debilitating diseases that influence their quality of living. When this quality of living is being compromised, they may then choose to use hospice care. Hospice is a holistic approach focusing on the mental, spiritual, physical, and emotional components of an individual. It focuses on the patient and their family and all their needs. It's supported by medical doctors, nurses, social workers, chaplains, home health aides, and volunteers for all needs to be met. The medical care is anticipated with a life expectancy of 6 months or less. It's a discontinuation of aggressive treatment. Most people find when they're ready to join hospice, it's when a disease does not respond to treatments. They have a few months to go. Patients are done with frequent ER visits and hospital admissions, and they want to focus in on comfort and a quality versus quantity of life. Hospice enhances a life with quality, a comfort, dignity, and respect throughout their journey. It neither hastens or it does not postpone death. There was a study in 2007 with the Hospice and Palliative Organization that they found people with certain terminal illnesses actually lived 29 days longer than people that were not in hospice. Hospice offers a slew of support and grieving supports. Grief support is provided for all ages in the community, regardless of affiliation with hospice, and Zoom classes are also available. The number is 518-724-0200. It's the local community hospice, and that's also the palliative number. There's programs such as for widows, daughters, teens, etc. They offer a Camp Aaron, which is a camp in Lake George, for grieving teens free of age 16 to 17. They also offer an awesome Wave Riders program. It's a 6-week program for ages 3 to 17 years old. Hospice services patients in many different environments. Inpatient hospital services, which one is located locally here, is at the St. Peter's Inn at St. Peter's Hospital. They provide services at home. They provide services at nursing home facilities. And there are a couple private hospice homes. Joan Nicole Home, shown on the bottom in Scotia, and the Gateway House of Peace, shown to the right. They're surrounded in a beautiful environment. They service 2 patients at a time with less than 3 months to live. They welcome all the family. They're allowed to cook, and that house is just like your own, free of charge.